Okay. Good morning, everyone. Myself, Dr. Anuj, Gaba, and I'm your anatomy faculty. So this is the workbook that has been specially designed for all of you, keeping in mind the changing pattern. And do not worry, this workbook will be good enough for you to pass your exam for FMGE and for your next exam as well. So in this workbook, I have kept a lot of topics that include starting from general anatomy, going to histology, then cystic embryology. After that, head and neck, neuroanatomy, thorax, abdomen, pelvis, upper limb, and lower limb. We'll do it all step by step, but let us start today's class with the basic terminology and general anatomy. So, what is anatomy? Anatomy is basically the science of structure and function of the body. Now, that means that in anatomy, we just do not study about the structure, but we also study about the function of the body. Now, we have to study that what is anatomical position, because everything in anatomy will depend on anatomical position. So, anatomical position is termed when a person is standing erect with upper limbs by the side and the face and the palm are directed forward. Now look at this person who is standing here. He's standing in the perfect anatomical position. That means that his face is facing forward, the palm are facing forward, the legs are facing forward, and the hands are by the side. That is the perfect anatomical position. Now, because of this anatomical position, we can divide the person into three ways. The first is called sagittal plane, second is called coronal plane, and third is called horizontal or transverse plane. Now, sagittal plane basically means that the anatomical plane that divides the body into right and the left section. Now, let us see that. Now, please look at this purple color plane that is trying to cut the human into two parts. We can see that this is dividing the body into right and to the left part. Now, the next one is called a coronal plane. That is a vertical plane running from side to side, dividing the body into anterior and posterior. Now look at this green color plane that is dividing the human being into anterior and posterior. Now, the last but not the least is the horizontal and transverse plane that is basically dividing the body into superior and inferior. Look at this beautiful yellow color plane. And look at the way it is dividing the body into superior and inferior. So these are the three anatomical planes, and these are very important for you to keep remember because this will help you in radiology as well. Now, the second terminology that you should remember is about cranial versus caudal. A lot of students do mistake here. We have to just remember a simple trick that cranial means anything that is directed towards the cranium. Now, what is a cranium? Cranium is your skull or your brain box. So, whatever is directed towards the brain box is called cranial. Whatever is directed towards your tail, towards your sacrum and coccyx is called caudal. Let us see that on this beautiful diagram. Look here. Whatever is going up is cephalic or cranial. One and the same thing, there is no difference. Whatever is going towards the coccyx or the sacrum is called caudal. That is towards the tail part of the human body. Now, what is rostral? Another very important term, very interesting term. Rostral is basically anything that is directed towards your beak. Now, humans do not have a beak. We have a mouth. So, whatever is directed towards our nose is called rostral. Please keep this in mind. This is going to be an expected question for all of you. Please keep writing the questions that I am telling as expected questions or PYQs. They have the highest chance of coming. Now, let us understand the difference between ipsilateral and contralateral. Basically, we have to first understand what is the name that we have to give to the image. Now, look at this beautiful image down, in which only one leg is highlighted. That is called unilateral, only one. Bilateral means two, so both the legs. Now, when it is one arm and one leg of the same side, it is called ipsilateral. When it is the arm and the leg of the opposite side, this is just an example, it can be anything. But if it is of the opposite side, it is called contralateral. So let us see the definition. Contralateral and ipsilateral. So those on the same side are called ipsilateral. These can be the fingers on the same side. This can be the arm and the leg on the same side. This can be the tumor on the same side. So anything that is on the same side is called ipsilateral. Anything that is on the different or the opposite side is called contralateral. Now, you have to understand another term that is called flexion and extension. We have to understand that flexion means that when we are bringing two body parts together or closer to each other, it is called flexion. When we are taking them away from each other, it is called extension. Now, adduction and abduction. In abduction, that is ABD, Abduction, we take the parts away from the midline, whereas in adduction, that is ADD, we bring the segments towards the midline. So kindly keep these in mind because these are very important for you to understand. Now, medial and lateral rotation. So, medial rotation is also called as internal rotation. Basically, when the joint is rotated towards the midline, look at this beautiful diagram. The hand is coming towards the midline. It is called medial or internal rotation. When it is going outwards or opposite, it is called lateral or external rotation. Can happen down in the feet as well. Now, supination and pronation. So, when the palm is moved upward, it is supination. When the palm is moved downward, it is called pronation. So there is a trick for all of you. Always remember, popes pronate. Popes always give blessings. So popes always pronate, whereas beggars always supinate. You will never forget this. Now, protraction versus retraction. Another beautiful question that is about to come in your exam next time probably. So expected question. What is the difference between protraction and retraction? Always remember a trick that I'm going to tell you now. That is retraction is equals to reunion. That means that whenever the scapula is coming towards each other, it is called retraction. When the scapula is going away from each other, it is called protraction. Same applies for your jaw. Look at this diagram. When the jaw is going towards, that is outside, it is called protraction. It is going inside, it is called retraction. So, inversion versus eversion. Another very easy term, but a lot of students confuse. So let us clear that confusion for once and for all. So whenever the sole, now your feet has a sole, that is the downward part. This is the hand, but we're talking about the feet. So whenever the feet, they are facing towards each other, it is called inversion. Whenever the feet, the sole are facing outward, it is called eversion. Look at this diagram. It is facing each other inwards, it is called inversion. Facing outward, it is called eversion. Now, these are the simple movements that most of the students know. Now, an expected question for your exam is circumduction. Why is it an expected question? Because circumduction is a complex movement which can happen in your limbs, hands, and fingers. It is basically a circular pattern of movement in which there is a sequential combination of 4 movements. That is your expected question that you should remember which 4 are required and in which way. So, firstly it is flexion, then adduction, then extension, then abduction. So do not forget this. This is an expected question for all of you. Now, palmar versus plantar. So as I was mentioning in inversion and eversion, the sole of the feet is called plantar, whereas the palm of the hand is called palmar. Do not confuse in them. Sometimes the examiner might not write sole. He might say the plantar surface. So plantar surface is always for your feet. Do not forget that. Now, fascia. What is a fascia? Fascia is basically the connective tissue that is surrounding and holding all your organs, blood vessels, bone, nerve fiber, muscle fiber, etc. Basically, each and everything of your body is being covered by a thin layer. It is called fascia. Now, the fascia is of 3 types. So, first is called superficial fascia. That is, most superficial is your skin. So, whatever is related to your skin is called superficial fascia. Whatever is related towards your internal organ, for example, to your gut, to your heart, to your whatever internal organs you can think of, we have a visceral fascia. But whatever fascia is covering your muscles, bone, nerve, and blood vessel, it is called your deep fascia. Do not get confused between deep and visceral. A lot of students get confused here. Make sure to make a note and put a star here to remember it again and again. Now, muscles. We are studying muscles for such a long time now, since class 6th or 7th, I guess. But we always get confused when the questions come a little trickier. So, we have to understand that a muscle can be of 3 types. It can be skeletal, smooth, or cardiac. Skeletal muscles are the muscles that are under the control of the human being. That means that I want to flex, I can use my skeletal muscles. But smooth muscles and cardiac muscles are not under your control. Smooth muscles, for example, your intestines, you cannot control your peristalsis, and cardiac muscles is your muscles of heart. You cannot control when to beat and when not to beat. It is in the hand of the gods. So, you need to understand how it looks. For example, if a question comes, that is an expected question for your exam, which is a very basic question in a PYQ for a lot of times. Which kind of muscle fiber is striated muscle fiber? So whenever it comes as a striated muscle fiber, it is always remembering two, that is skeletal and cardiac. Remember that smooth is never striated. Now another question that is expected question in a PYQ is that which kind of muscle fiber has intercalated disc? So the answer for that is going to be cardiac muscle fiber. Do not click skeletal or smooth. The answer is cardiac muscle fiber. These were the two expected questions and a PYQ, very basic ones. So now let us go towards the next subheading, that is the actions of muscles. Now the muscles can have different kind of actions. Four are the most important action, that is the prime mover, antagonist, fixator and synergist. Now let me explain that all to you in a very basic example. Now look at this example. Whenever someone wants to flex his elbow, we say that the bicep muscle is going to work as what? Biceps brachii is going to work as the agonist, or also called as a prime mover. Basically means that the muscle that is going to flex, which is responsible for this movement, is called the prime mover or agonist. Now we remember chemistry. Agonist always have an antagonist. So remember, biceps is the agonist. So triceps is going to be the antagonist. Now there is something called as a synergist. To make it simple for all of you, remember, like a boy likes a girl or a girl likes a boy, which is again equally possible, whereas doesn't happen a lot. But for example, if a boy likes a girl and he's like, kaise pataun, how should I get around her? So he sends one of his friends to talk with the friends of the girl to know if she is single or not, and to get more information, what she likes, what she doesn't like. So that is called a middleman. So that middleman is basically not going to propose the girl, but is going to help the guy to propose the girl. So that is called a synergist. So in this movement of flexion of the elbow, biceps is the agonist or the prime mover, tricep is the antagonist, whereas the brachialis muscle, that is the brachialis muscle, is also in your arm and the forearm. So it is also working as a synergist. Always remember that. Now, going to the next subheading, that is the shapes of the muscle. For shapes of the muscle, you have to remember that there are different kind of shapes of the muscles, starting from fusiform, going to parallel, convergent, unipinnate, bipinnate, multipinnate, and circular. Now let us start the basic one, that is fusiform. Fusiform are the muscles that have tendon at the ends and a muscle belly in the center. So for example, your biceps has a tendon on the top and has a tendon down here. So there are two tendons and a muscle belly in between, that is called fusiform. Now, parallel muscles, always remember, a parallel muscle will always have a word in the name that is called rectus. So, rectus abdominis is the basic example for parallel muscle, but there is an exception to this rule, which is an expected question for all of you, that what is rectus femoris? So, always remember that rectus femoris is a bipinnate muscle, even though it has rectus in the name. Now, convergent. Convergent means that the muscle fibers are going to converge at one point. They finish at one point. They start at different point, but they finish at the one point. That is called convergent. For example, pectoralis major. Now, unipinnate. Pinnate is basically a Latin term that means feather, the feather of the bird. So, feather, that means the stem is there and then the feathers are only on the one side. There are no feathers here, only feathers on the one side. That is called unipinnate. The basic example is palmar introtia, that is the muscle in your hands. We'll study that when we are studying upper limb and hand. Bipinnate, as I mentioned, very beautiful question that is always asked and expected question for your next exam is rectus femoris. Multipinnate, that means that a muscle that has many fibers or feathers that are coming together on one point. Now these are basically stems that have feathers on both the sides, but they all converge at a single point. That is called multipinnate. And the most beautiful example of that is your deltoid muscle, that is here, that is giving the roundness to your shoulder. Now, the last shape of the muscle that you have to remember is the circular muscle. That is the basic example for orbicularis oculi. That is the muscle that is responsible for closing of your eye. There is also known, there is another muscle that is called as orbicularis ori. That is the muscle that is closing your mouth. So always remember these. Now, tendon. What is a tendon? So tendon is basically a cord which is similar to a rope, which basically, now always remember, highlight that in your notes, that tendon always connect muscles to the bone. Do not do the mistake. They are going to be different terms that we will study later. Tendon are the one that connects the muscle to a bone. The most famous tendon of the whole anatomy is Achilles tendon. That is the tendon of the calf muscles. Another special term which you have to remember is aponeurosis. Now, what is aponeurosis? Aponeurosis is also a connective tissue, but it is a pearly white in color, and it is basically the connective tissue that takes place in flat muscles. Instead of tendon, flat muscles will have aponeurosis, and the most important example that you have to remember for aponeurosis is the abdominal aponeurosis. Now, the next term that you have to remember is raphe. So, what is a raphe? Raphe is basically the interdigitating fibers of the aponeurosis. So, you have to remember these are three different terms. Tendon is like a rope. Aponeurosis is in the flat muscles, whereas raphe is the interdigitating fibers of the aponeurosis. So, raphe, the most important example in your anatomy is mylohyoid raphe that is present in your neck. Now, just to recap the muscles, you have to remember that muscle is having two parts, a fleshy part and a fibrous part. The fleshy part is always called as the belly of the muscle. The fibrous part can be of three types. It can be a tendon, it can be an aponeurosis, or it can be a raphe. So always remember these three things. Now, let us study about the joints. One question is always coming in the exam. So always remember to study this in more depth. I will teach you this in more depth when we study it later on. But this is just as an introduction, so do not worry. So, joints can be of three types. First is called fibrous joint, second is called cartilaginous joint, and third is called the synovial joint. Fibrous joint are the joints that are immovable joints. They cannot be moved. For example, the joints in your skull. Can you move your skull joints? The answer is no. Cartilaginous joints, that are the joints that are semi-movable. For example, the joints in your pubic symphysis. That is a cartilaginous joint. That means that when the lady is parturiting, when the lady is giving birth to a baby, that joint stretches a little bit. So, cartilaginous joint. And synovial joint are the freely movable joint, like the joints of your hand, of your elbow, of your hip, etc., etc., etc. So, let us study first the fibrous joint. So, fibrous joint are of three subtypes, that is suture, syndesmosis, and gomphosis. So, suture are present in your skull. Syndesmosis is present in between your radius and ulna bone. We'll show that to you later on when we are studying upper limb. And gomphosis is the joint between your alveola, that is basically your tooth joint, or the tooth socket joint is called gomphosis. Now, synovial joint. You have to remember that synovial joint is of different types, that is ball and socket joint, hinge joint, pivot, ellipsoid, saddle, condylar, and plane and gliding joint. Don't worry, I will give you a list of the joint and the examples that you have to remember, which is probably going to come in an exam, in the next exam. So please read that, remember that, revise that again and again. Now, last but not the least is the cartilaginous joint. There are two types of cartilaginous joint. The first is called primary, second is called secondary. Primary cartilaginous joint is also known as AKA, also known as synchondrosis. And the secondary joint is also called as symphysis. So, the most basic example that you have to remember for primary is the epiphyseal plate. That is basically the plate that is in the embryology of your bone. We'll see that later in the general embryology part for sure. And the joint between your first rib and the sternum that you have to remember as a primary cartilaginous joint. In secondary cartilaginous joint, the most famous example is pubic symphysis, a PYQ and an expected question for your exam. Now, ligament. Another very important point, put a star here, that ligament connects bone to a bone, whereas a tendon connects muscle to a bone. A lot of students do a mistake here and they lose a point. So do not do that silly mistake. So ligaments can be of two types. It can be a fibrous ligament or an elastic ligament, depending on what is the nature of the ligament. Now, bursa or a bursa, whatever you like to pronounce it, that's fine. So bursa is a small fluid-filled sac that reduces the friction between the moving joint and your body's joint. Now, no need to get into the depth. Just remember, it is like a balloon. Now, let me give you an example. Look at this beautiful diagram. This is the diagram of your knee joint. So in the knee joint, we have a lot of bursas. There is a patella bone here, and then there is a bursa up, a bursa behind or in front of it, and a bursa down. So there can be an inflammation of any of the bursa, that is called bursitis. So if the inflammation is of the pre-patellar bursa, it is also known as housemaid's knee, I expected quotient in a PYQ. If it is the inflammation of this bursa, that is the infrapatellar bursa, it is called as clergyman's knee. So do not forget these things and do not worry. These will be taught to you again by me when I'm teaching you the lower limb chapter. I'm just telling you these things so you're prepared when we are studying those as well. Now, what is a synovial sheath? A lot of students do not remember that after they finish their first prof of anatomy, but understand that synovial sheath is nothing. It is basically a connective tissue that is present wherever a tendon passes under the ligament. A tendon that passes under a ligament. Now, what was a tendon? Tendon was connecting a muscle to a bone. Ligament was connecting bone to a bone. So wherever these pass, there can be a lot of friction. To decrease this friction, the body has given a beautiful oil. It is called as a synovial sheath. Now, synovial sheath produces a liquid called as synovial fluid that basically acts as a grease and lets the friction down so your body can function properly. Now, blood vessels, another very beautiful and a small topic that we will discuss later, but let me just give you an introduction. So blood vessels, as we all remember from class 6, artery, arteriole, capillary, venuole, and vein. These are the 5, or I should say 6 or 5 structures that are in sequence. So there is another term that we always use and a lot of students get over it when we are studying this. It is called as arteriovenous anastomosis. Now it is a big term, a mouthful, and a student get afraid. But you have to remember that arterio, that is artery side, and veno, that is the venous side. Anastomosis, that means the attachment of both of them. Basically, the capillary network system is called arteriovenous anastomosis. So if you study good books like Snell's and Gray's Anatomy, they will show it as an arteriovenous anastomosis. No need to worry. We'll see that later. Now, in capillary, very interesting to remember that there are 3 types of capillaries. The first is continuous capillary, second is called fenestrated, and the third is called sinusoidal. Look at this beautiful diagram. Continuous capillaries have a continuous basement membrane as well as a continuous endothelial layer. There is no gaps. There are minute gaps for the passing of the fluid, for the passing of the nutrients, but there's no major gaps. It is called continuous and it is mostly found in the muscles. Now, fenestrated. In fenestrated, the basement membrane is still continuous, but the endothelial layer has a lot of holes. Looks like a chutney. So, it is basically called fenestrations in a good language, in scientific language. So, this is found inside the intestinal villi. And last but not the least, the sinusoidal, in which even the basement membrane and even the endothelial layer, they have a lot of disruptions for passing of big cells. So basically this is present inside the bone marrow. So next and most important for the human to stay healthy and alive is lymphatic system once again. So lymph is basically the intracellular fluid that is present, that is basically leaked out from the connective, from the artery and veins and capillaries. So this fluid that is accumulated outside the cells is not going to be taken back itself. It cannot even be kept there. So there is a system that is responsible for carrying this lymph from that place back to the circulatory system so that it can circulate once again in the whole system. It is called lymphatic system. Lymphatic system is composed of lymphatic organs and tissues, lymphatic vessels and lymphatic lymph nodes. These are basically responsible for your immunity. We'll study that in detail in pathology, but in anatomy, you just have to remember some terms like cisterna chylae, spleen, lymph nodes, thymus, bone marrow. We'll study that in detail later on. Do not worry. This is just a heads up for all of you. So, another very important system for all of you is called nervous system. So, nervous system is basically of 2 types, CNS and PNS. So, CNS, always remember the trick. Whatever is in the center is called CNS. So, the brain and the spinal cord is the CNS. But whatever nerves are going out are called PNS. So, PNS includes the somatic nervous system. So, somatic nervous system is responsible for the voluntary muscle movements. For example, I want to flex my elbow. I want to move my head. So, these are all voluntary movements. How are they happening? They're happening because of the nerves. So, whatever nerve is responsible for a voluntary movement will come under the somatic nervous system. That is a sub part of the PNS, not the CNS. Do not do the mistake. It is a PYQ for a lot of times. Then there is the ANS. So ANS has 3 subsystems, that is the parasympathetic, sympathetic and enteric. So parasympathetic, which is basically when you're relaxing. Now, sympathetic is when you are alert, and enteric is for a digestive system. There is an error here. Do not mind that. Please cut it here. And always remember, sympathetic is for fight and flight, and parasympathetic is for rest and relax. Please cut it from here. It is written wrong here. I'm again mentioning there is an error in the diagram. Do not remember it like this. Again, repeating, sympathetic is for flight and fight, and parasympathetic is for rest and relax. Now, there are two types of membrane, mucus and serous. Now, just a trick to remember, always and always remember that the mucus system is going to cover the body systems of yours that are in contact with the exterior environment. Basically, your digestive system, your respiratory system, your urinary system, and your reproductive system. So these four systems are lined by a mucous membrane, which keeps on producing mucus. Now, serous membranes are basically producing a clear fluid that basically act as a cushion or a lubricant. So serous membranes are only specifically, remember, are at three locations. That is at the peritoneum, at the pericardium, and at the pleura. So do not worry. Always remember, this is an expected question, that where is the serous membrane present, except peritoneum, pericardium, pleura, all of them, none of these. It can come like any of these questions. So please remember the whole notes. Even though we are telling you expected questions and important question, but you still have to remember the whole notes and listen to the whole lecture. Now, bones. Very beautiful topic. So bones basically can be of different types, like long bone, short bone, flat bone, irregular, and sesamoid bone, depending on the type. So there are different types. So you have to remember different examples because they can also be asked. So flat bone, the basic example is skull and sternum. For irregular bone, remember vertebra and pelvis. For long bone, remember femur, humerus, your phalanges. These are all long bones. Sesamoid bone are beautiful two examples, that is patella and pisiform. And for short bone, there are two examples, that is the carpal bone and the tarsal bone. So carpal, it can also be written as carpus, no worries. So singular is carpus, all are carpal. So next is tarsal bone, that is in the feet. So basics of fracture, basically remember the definition, that discontinuation in the continuity of the bone is called fracture. Now this you will study more in detail in orthopedics, but I've just put it here to give you a heads up again. So fracture can be of different types. It can be a green stick, transverse, comminuted, spiral, or a compound fracture depending on the type. So look here, green stick fracture is an incomplete fracture. Basically it happens a lot in the children. It is not complete. It starts from one side but doesn't finish. Transverse fracture, the most common fracture that we see in the OPDs, the fracture or emergencies as well, that the fracture is straight. The bone is broken straight. So this is called a transverse fracture. Comminuted fracture, basically a type of crush fracture. That means a person falls down and the bone is crushed into different pieces, and these pieces, they can go and puncture an artery or a vein or a nerve. So a person might be in a little bit of trouble. So this is kind of emergency that we have to take care of. Spiral fracture. It is also a complex fracture. Why I am saying a complex fracture? Because you have to understand, look at the head. The femur head is rotated. So for example, a person was standing straight, but a car came and bumped into him. When it bumped into him, the person's leg got twisted, the femur got twisted, and the fracture happened. So it happened something like this. So it is called a spiral fracture. Again, it requires the bone to realign. We can use rods and plates in surgeries. We have to put a plaster. So you will study more that in orthopedics. This is just introduction. Now, compound fracture, very important. Compound fracture is also a kind of complex fracture because in this you can see that the bone or the spicule or the part of the bone is coming out. It is coming out of the skin. That means there is a direct contact between the skin and between the bone or the interna with the externa. That is why there is a higher chance of sepsis, blood loss, and the patient is in a lot of complications. You have to rush the patient to the ER, do the surgery, and stabilize the patient. Now, one expected question, at least from this slide, make a star, make a PYQ, make a EQ. This is going to come in your exam for sure. So, the different kind of epiphysis in your bones. There are 4 subtypes. pressure epiphysis, traction epiphysis, atavistic epiphysis, and aberrant epiphysis. So pressure epiphysis is basically, you have to remember the examples as I have written, because you cannot really write anything else or select anything else. The upper and the lower end of femur, that is the femur bone, upper as well as the lower end is a pressure epiphysis. Upper end of the humerus, the upper end of the tibia, and the lower end of the radius. These are the pressure epiphysis. I know it is a little bit of mouthful, but once or twice you say it again and again. Once you touch it on yourself, you will remember that easily. Always remember that anatomy is the only subject in which we are allowed to cheat, because we can take our own body inside the examination hall. Everything else will be kept outside. So if you remember these on your own body, you will never forget them. Traction epiphysis. So before traction, let me make you understand pressure epiphysis. So pressure epiphysis is epiphysis or a part of the bone that helps in transmission of the body weight from one end to another end. So upper and lower end of the femur, upper end of the humerus and tibia, and the lower end of the radius are the pressure epiphysis. Traction epiphysis, that means that the traction epiphysis are the parts of the bone that have a lot of traction or a pull coming on them from the muscle or the tendon. So always remember a trick, TT. So greater and lesser tubercle and trochanter of the humerus and the femur are traction epiphysis. But there is another example that is called the mastoid process of your skull, is also an example of traction epiphysis, which is the PYQ and a EQ for your exam. Now, atavistic epiphysis. So atavistic epiphysis basically means that during the evolution, during anthropology, we study that when we were apes, when jab hum bandar the, we were used to climb a lot of trees. We needed more muscles in our scapula, in your shoulder. At that time, your coracoid process, that is a part of your scapula, was a separate bone itself. But when we became human, we do not climb trees anymore. So that is a coracoid process that is now a part of scapula, not a separate bone. It is called atavistic epiphysis. Aberrant epiphysis. Aberrant in English means wrong. So remember only one example. That is the head of the first metacarpal. It is your aberrant epiphysis. Do not worry about the base of second to the fifth. Just remember head of first metacarpal. Now, another expected question from this slide, make a star and remember, this is a mnemonic for hybrid and composite muscle. Now, what is a hybrid or composite muscle? So, hybrid or composite muscle are those muscles that are being supplied by two nerve supplies. Not just one nerve, but two nerves. So, there is a mnemonic for it, that is BP, bad for the students, in which B stands for brachialis, P stands for pectoralis major and pectineus, B stands for biceps femoris, not biceps brachialis, A stands for adductor magnus, D stands for digastric, F stands for flexor digitorum profundus, that is FDP, and flexor pollicis brevis, that is FPB. T stands for trapezius and S stands for subscapularis. That is the last part of your chapter number 1. That is the basic anatomy and introduction to anatomy. So make sure to remember whatever I said as a EQ and a PYQ and as a lot of these things. If you have any doubt, make sure to reach out to me at your platform, and I'm more than happy to help you out. Thank you so much.